Welcome all. In this class, we are going to discuss about menopause. It is an important syllabus point in second paper. In the syllabus, it is written menopause. We have to study menopause, its changes during menopause, menopause syndrome, and its management. Coming to the definition of menopause. Definition: permanent cessation of menstruation at the end of reproductive life due to loss of ovarian follicular activity. So menopause can be defined only when there is permanent cessation of menstruation, and it is due to the loss of ovarian follicular activity. We all know that towards menopause or a few years prior to the menopause, there is the loss of ovarian depletion of the ovarian follicles. The number of ovarian follicles begin to deplete. As a result, there is a resistance of ovarian follicles. That is, the follicles may become resistant to the hormones produced from the hypothalamus and pituitary. We all know that menstruation only happens when there is a coordinated activity of the hypothalamus, pituitary, and ovary. That is the coordinated activity of the HPO axis. So towards menopause, there is resistant ovarian follicles. The follicles does not respond to the hormones from the pituitary gland. So there is loss of ovarian follicular activity. As a result, there is no menstruation. Clinically, the menopause can be diagnosed only when there is absence of menstruation for 12 consecutive months. That is, there is absence of menstruation. There should be absence of menstruation for 12 consecutive months. Then only we can diagnose a lady as a case of menopause. And the average age of menopause nowadays is 50 years. In Ayurveda classics also, 50 years is defined as the age for menopause. Jara pakwa shariranam yadi panchashadaha kshayam. At the age of 50, the menopause happens. Panchashada urdham chera upajiyamana sharira dadunam kshayam yadi. At the age of 50, there is the kshaya of dadus. Here we can see that there is the kshaya of or the depletion of the ovarian follicular activity. So the age of menopause is 50 years. Yadi panchashadaha kshayam. It is explained by Acharya Ashtanga Acharya Pakbhada. So 50 years is merely stated as the age of menopause in Ayurveda classics. Then coming to the changes. What are the changes happening during menopause? The changes in the HPO axis is like that. There is increase in the follicular stimulating hormone, that is FSH. As a result, the estradiol level fall and there is increased androgen production. So the changes in the hormonal level is like that. FSH level raises, the estrogen level fall, and the male hormone androgen secretion gets increased in a case of menopause. Then what are the changes at the level of organs? The changes in the ovaries is that the ovaries shrink in their size. The ovarian follicles does not respond to the ovarian pituitary hormones. The ovaries shrink in their size. Then coming to the fallopian tubes, the fallopian tubes nearly go to a stage of atrophy. The cilia is almost absent in the fallopian tube. We all know that the cilia is present inside the lumen of the fallopian tube for the normal transport of the sperm. So at the age of menopause or at menopause, there is absence of cilia of fallopian tube and the fallopian tube get atrophied. Then coming to the uterus becomes smaller. Finally, it get atrophied. Then in some cases, we can see the uterine descent. As the pelvic floor muscle loses the tone after menopause, the pelvic organs may get prolapsed. That is, we can see in the uterine descent. Also, the pelvic organ like bladder may also descent. That is called cystocele. That is why the cystocele and uterocele, that is the descent of the bladder and the descent of the uterus, is common in the menopause age. There is estrogen receptors at the level of muscles of the pelvis. So when there is depletion of estrogen muscles, there is loss of tone of the pelvic floor muscles, and as a result, the pelvic organs get prolapsed. Then coming to the endometrium becomes thin as there is no ovarian hormones for the proliferation of the endometrium. The endometrium becomes thin and finally gets atrophied at the age of menopause. Then the vagina becomes narrower, and the normal bacteria seen, that is Dodderlin's bacteria normally seen in the vagina, becomes absent at the age of menopause. Then the alkaline pH. We all know that the normal pH of vagina is acidic pH, but after menopause, it becomes alkaline pH. So the menopause ladies are prone to infections. Then coming to vulva, the vulva also get atrophied. The labia majora gets flattened. The pelvic, the hair also there get lost. And the bladder and urethra, there is the symptoms or the changes seen, we can see is there may be dysuria, there is urgency of maturation, then stress incontinence. Stress incontinence means during sneezing or during coughing, there is the leakage of urine. Then frequency, the frequency may be increased. Then dysuria, there may be painful maturation. Then urgency, the lady does not get the control over the bladder, so that they may be leaking of urine when she feels to, when she have the urge to urinate, there may be leaking of urine. These are all due to the loss of the pelvic floor muscle tone. Then coming to the bone metabolism, the estrogen hormone is important, or it plays a good role in bone mineralization. So after menopause, there is the depletion of the estrogen hormone, or there is mere absence of estrogen hormones, and the bone mass density decreases. Then coming to the cardiovascular system, there is a risk of the cardiovascular diseases increases. The estrogen hormone plays an important role in maintaining the lipid levels of body. That means the estrogen level helps to maintain the helps to increase the HDL, high density lipoprotein, and it helps in normal for maintaining the health of the cardiovascular system. But after menopause, the estrogen level falls. As a result, there is a risk of the cardiovascular diseases. Then skin and hair changes. The collagen may be lost in the skin. So as a result, we can see purse string around mouth and crow feet around eyes. That is the wrinkling of skin around the mouth and around the eyes. Then coming to the menopausal symptoms. The symptoms may be seen are menstrual symptoms, then vasomotor symptoms, psychological symptoms, sexual dysfunction, urinary symptoms, and other miscellaneous symptoms. These symptoms may be seen many years prior to the menopause and after menopause also. That means it is called perimenopause. That is around the menopause age, we can see these symptoms. Coming to the menstrual symptoms, the cycles become shorter and there may be irregular bleeding, maybe dysfunctional uterine bleeding or heavy menstrual bleeding can be seen. Then coming to the vasomotor changes, it is the most common symptom found, that is hot flashes. That means the lady feels a sudden feel of heat and sweating. It is called hot flashes. This is due to the due to the imbalance in the thermoregulatory system of the brain. That is, the lady feels a feel of heat and then she sweats for a time. It is very common. Then upper body sweating can be seen. Then anxiety, lack of sleep, etc. can be seen. Coming to the psychological symptoms, irritability, mood swings, poor memory, depression can also be seen. Coming to the sexual dysfunction, there may be vaginal dryness and dyspareunia. The vaginal dryness is like that. The secretions, the vaginal pH changes, the alkaline pH change, and there may be less secretion and it leads to vaginal dryness. Thus, the sexual activity becomes very painful and it is called dyspareunia. Coming to the urinary symptoms, incontinence, we have already seen the common symptoms in is stress incontinence in urinary symptoms. Then urgency, dysuria can also be seen. Then other symptoms are backaches, joint aches, etc. So the menopausal ladies are prone to many fractures. Most common fractures seen in menopausal ladies are the Colles fracture, that is the fracture of the distal end of the radius, then vertebral fractures, then femoral head fracture. This is due to, we already said, the estrogen hormone is responsible for the good absorption of calcium from the gut, and it play an important role for bone mineralization. So after menopause, there is no estrogen, thus the bone becomes prone to fracture. Osteoporosis happen. So these are the common menopausal symptoms seen. Coming to the management. The management is two types, that is non-hormonal and hormone therapy. Coming to the non-hormonal management, first one is lifestyle modifications. Lifestyle modifications, if she is using alcohol or she smokes, she has to leave. She has to avoid that smoking and alcohol. Then supplementary calcium. Supplementary calcium along with the vitamin D3, that is 1000 to 1500 to 2000 international unit vitamin D3 along with calcium should be supplemented. Then nutritious diet. Nutritious diet rich in calcium and protein should be followed. And vitamin D have already said. Then proper sunlight exposure should be done. Then vitamin E and soy proteins. Soy proteins play an important role in reducing the hot flashes seen in menopause ladies. Vitamin E also is good for this hot flashes. So these are the non-hormonal management. Then coming to the hormonal management, that is hormone replacement therapy. Hormone replacement therapy is good for reducing the vasomotor symptoms and psychological symptoms, etc. So some group, the indications of hormone replacement therapy: premature ovarian failure, then gonadal dysgenesis, then surgical or radiation menopause. In these three conditions, hormone replacement therapy should be done. Then what are the contraindications? If a lady is already undergone a treatment of breast CA, or she is having a disease of deep vein thrombosis, or she has liver disease, or an undiagnosed genital tract bleeding, or she had prior endometriosis or estrogen dependent neoplasm is there, the hormone replacement therapy should be avoided. But in this the indications that special group, that is all, the lady already attained menopause earlier, that is premature ovarian failure. Then that is the ovarian follicular activity stop before the age of 40 is called premature ovarian failure. These are the special groups where the hormone replacement therapy should be done. In premature ovarian failure, gonadal dysgenesis, and surgical or radiation menopause, the hormonal replacement therapy should be done to reduce the menopausal syndromes. So in our practice, some of the common yogas we are used for the management of the menopausal syndromes are Drakshadi Kashaya. Drakshadi Kashaya is Vadapittahara, we know. So it is good for good sleep and reducing the psychological symptoms. Then Chandraprabha Vadi. Belaguluchiatis Thaila, both external application and on the head application, it is good for reducing the hot flashes and for good sleep. Chandanasava is used for treating the urinary related symptoms, as the vaginal epithelium get atrophied. The lady may be prone to some urinary vaginal infections. Also, urinary infections may be seen in menopause ladies due to the absence of the estrogen. This Chandanasava is very effective. Then Yoni Piju for reducing the dryness of the vagina. Yoni Piju with some Thaila or Krida is practiced. Then Yoni Vasti with Thaila. Then Yoni Apyanga, Yoni Prakshalana to reduce vaginal infections. These are the common yogas practicing for menopausal syndromes. That is Rakshadi Kashaya, Chandraprabha Vadi, Velaguluchiadi, etc. Then some Sthanika Chikilsa like Yoni Piju, Yoni Vasti, Yoni Apyanga, and Yoni Prakshalana are also done. So thank you all.